Hello friends, welcome back. Next topic is barriers faced by health workers in delivering healthcare services. So, health workers are key to health system, but they face various barriers, which definitely affects quality and delivery of healthcare services. So, what are the barriers? There are many. We have categorized them into six parts here. So, the first part is individual or personal barriers. Sometimes there is heavy workload and long working hours. There is inadequate knowledge and skill, lack of motivation and job satisfaction, stress, burnout, fatigue, poor physical and mental health, fear of infection, example HIV, TB, COVID 19. So these all inhibits an individual, hence individual or personal barrier. Next is health system barriers. Health system barriers means a single person is not responsible. There are multiple levels involved, like shortage of staff and high vacancy, inadequate training and supervision, irregular supply of drugs, equipment, and logistics, poor infrastructure and facilities, inefficient referral and transport system, lack of supportive policies and guidelines. Next is administrative barriers. Means there is excessive paperwork and reporting, poor planning and management, delay in decision making because there are a lot of people involved at various hierarchy levels, lack of coordination among departments, frequent transfers and postings, inadequate recognition and incentives. The next comes is socio-cultural barriers, means negative attitude of community, low health literacy and awareness, cultural beliefs and practices, gender discrimination, lack of community participation, violence, abuse, or harassment by patients or relatives. So, these are some socio-cultural barriers, like in the community, which are bound to be found. Economic barriers. There is low salary and inadequate financial benefits, delayed payments and allowances, out of pocket expenditure, lack of career growth or promotion. The last is physical or geographical barriers. There is a difficult terrain in remote areas where accessibility is poor, lack of transport facility, poor road connectivity, poor housing and living conditions, natural disasters and emergencies. Okay, so the barriers we have discussed are individual barriers, health system barriers, administrative barriers, socio-cultural, economic, geography. Okay, consequences will be reduced quality of care, low motivation and job satisfaction, high absenteeism and turnover, poor utilization of health services, and inefficient health system performance. Okay, so what are the measures to overcome these barriers? First, there should be adequate staffing and regular training, provision of drugs, equipment, and infrastructure, supportive supervision and feedback, timely salary incentives and allowances, community participation and awareness, safe working environment and security, recognition and career development. Okay, so these are the measures which help us to overcome these various barriers we have discussed. Now, if the barriers are asked specific, example, what are the barriers under maternal and child health? Then we can say poor ANC registration, home deliveries, low female literacy, early marriage, poor nutrition, poor immunization acceptance. Okay. Next is family welfare. Then there is fear of side effects. If we are suggesting them contraceptives, there is a fear of side effects. Male child preference, religious beliefs, lack of counseling, opposition from husband or family. If we see for malnutrition, what can be the barriers? Then we can give dietary advice, but what about the poverty they are facing? Food insecurity, poor infant feeding practices, recurrent infections, lack of nutritional education. PHC services, there can be shortage of doctors, drug stockout, poor referral transport, long distance to PHC, lack of any diagnostic facilities. Right. Measures to overcome: strengthen primary healthcare infrastructure, ensure adequate manpower, drugs and logistics, Regular training of healthcare workers, community awareness through IEC and BCC activities, improve transport and referral services, promote community participation through ASHA, village health sanitation and nutritional committee, and Panchayati Raj institutions. Strengthen monitoring, supervision and inter-sectoral coordination. So conclusion is, effective healthcare delivery requires addressing barriers at community, health system, health worker, administrative and environmental levels. Okay. So if in a flowchart we see, the barriers are in community, health system, health worker, administration, geographical. Tackling them all will help us in better delivery of services and utilization of services. Thank you.